On this Tuesday night, critical aid in a crisis.
When an opportunity comes to help your own country, I'll raise my hand for that.
Newfoundland and Labrador lends a hand to Ontario, sending a team of doctors and nurses. The first reported death in Canada linked to the AstraZeneca vaccine.
It's really unfortunate, and we need to be very clear about that.
Plus, Ontario and Ottawa fight over paid sick leave. And the province-wide lockdown looming over Nova Scotia. Canada's tax deadline creeps closer, the complications and how to get a refund sooner. And a novel idea.
Started with one line and then we just kept going.
How lockdown inspired a labor of love.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with efforts by one of Canada's smallest provinces to help Canada's biggest get through a crushing third wave of COVID-19. Newfoundland and Labrador is sending reinforcements to Ontario's overburdened hospitals. A team of 9 doctors and nurses boarded a military plane this morning bound for Ontario. Among them, Dr. Alison Fury, wife of Newfoundland and Labrador Premier Andrew Fury. They're expected to start working tomorrow at Toronto hospitals. Ontario certainly needs help, and though this team isn't big enough to turn the tide, it is a practical, decent and neighborly thing to do when others are in crisis. Eric Sorensen has our top story tonight.
The cavalry has arrived. 3 doctors and 6 nurses from Newfoundland and Labrador to be deployed in Toronto area hospitals. Among the team members, the Premier's wife, who's an emergency physician.
I will be in a COVID ward in one of the hospitals, so actively caring for patients with COVID-19.
The Canadian Armed Forces are also assigning 9 ICU nurses and up to 3 medical assistance teams to help. The need so great in Ontario that beds in big tents are now in use outside Sunnybrook Hospital.
Sending men and women in uniform to help in Ontario is a serious step. We're doing this because the situation requires it.
As in previous waves of the pandemic, Ontario doctors are prepared and trained to decide who gets critical care. But it's not like a train crash, says one doctor, where everyone needs help the same day. There is optimism hospitals will not have to triage critically ill patients.
When you're getting 1,000 critical care patients spread over the course of weeks, which we are here, then there is an opportunity to adapt the system and grow capacity.
And there is reason for optimism in Ontario's brutal third wave. The average in new daily cases passed 2,000 a month ago, 3,000 on April 8th, 4,000 on the 14th, and peaked at almost 4,400 April 17th. But it has trended lower since then. The 7-day average today fell below 4,000 for the first time in 2 weeks. Hospitalizations and ICU cases continue to rise, but could start to level off in a couple of weeks if we're careful.
I think we have to continue to make sure we don't relapse and go back into a state where we don't have enough healthcare facilities to take care of these patients.
For now, Ontario is getting much needed help from Newfoundland and Labrador, where people have a history of lending a hand.
It's just the way that Newfoundlanders are. They are giving to their communities, both locally and in their own country and abroad.
A heartening gesture from a small province to the biggest. Eric Sorensen, Global News, Toronto.
Last week, Ontario Premier Doug Ford promised his government would finally set up a paid sick leave program, which essential workers desperately need. He claimed it would be the best program anywhere in North America, bar none. Well, today we did get a bit more information, but Ontario is not launching its own program. It wants to piggyback on a federal one, and Ford's promise is turning into a bit of a political fight. Global's Queen's Park Bureau Chief Travis Dhanraj is with me from Toronto. Travis, what is going on with this?
That is a question that so many essential workers in this province really want the answer to right now, Donna. And this has been a political football, paid sick days for months now. The Premier really not wanting to budge on this issue until, as you said, last week on Thursday, when he promised that this would be the best program in North America. So the expectations were fairly high for what this program would be. Well, the only plan that exists right now, as far as we know, is for the province to top top up the federal program with an additional $500 for essential workers for a total of $1,000 a week. Now, my sources tell me that that is a non-starter, that the federal government has already let the province know that, and that they say that that is a logistical nightmare. Now, Deputy Prime Minister Chrystia Freeland's office put out a statement today, and that reads in part, when Ontario is ready to mandate sick leave in provincially regulated businesses, as we have done for federally regulated businesses, we will be there to help. Now, the Prime Minister was asked about all of this today. Here's what Justin Trudeau said.
We are there to help Canadians. We have people's backs. We need to work together, and provinces need to look at the way to deliver sick leave directly through employers, which the federal government can't do.
So, Travis, does this get essential workers any closer to a paid sick leave plan in Ontario?
It doesn't, at least not for right now. There is no timeline in place. And the Labour Minister here in Ontario was asked about what an alternative plan is. He didn't really have any clarity on that. And this really brings into question the safety of workers going to work who don't have a choice to stay home. The Leader of the Opposition assessed where we are right now as a province.
To suggest that we have time to wait. I just can't believe that the government think that it's okay to continue to drag their feet while people's lives are literally hanging in the balance. Completely irresponsible. It's despicable, and they have to stop this political back and forth.
Now, this all comes with the backdrop of the third state of emergency in this province, and also as the Canadian Armed Forces get set to come on the ground here in Ontario once again. Donna?
All right, Travis. Dhanraj in Toronto. Thank you. Quebec is reporting the first death in Canada linked to the AstraZeneca vaccine. A woman in her 50s died after developing a rare vaccine-induced blood clot in her brain. Quebec officials have no plans to change their vaccine strategy, though, saying the benefits of the vaccine still far outweigh the risks from COVID-19. Our Mike Armstrong is following this story for us tonight. Mike?
Well, Donna, the Quebec government only got confirmation that a blood clot was the cause of death at noon today. That confirmation came from a laboratory in Hamilton, Ontario. The announcement came in Quebec City, made by the province's public health director. The woman who died was 54 years old and lived in the Montreal region.
If we knew that she was going to do it, we would not give her the vaccine, but it's impossible. But I don't regret, because we are sure we are preventing more deaths and more complications of the disease, even with that vaccine.
Quebec has opened up the AstraZeneca vaccine to anyone between 45 and 79 years old. So far, it's administered about 400,000 doses. Now, going in, it knew the chances of complications due to blood clots was about 1 in 100,000. The health minister says that's right about where Quebec is right now.
So far, within 400,000 of AstraZeneca, we have less than 4 cases. So we are within those numbers. So it's really unfortunate, and we need to be very clear about that. But I think that's the price to pay to be vaccinated and to be going back to a normal life at one point in time.
The government is not changing the vaccination protocols since this death. They say they're always watching the numbers for complications. Quebec has so far vaccinated about 33% of the province with at least 1 dose. The goal is to hit 75% by June 24th, the national holiday here in Quebec. Donna?
Okay, Mike Armstrong in Gatineau, Quebec tonight. Thanks. Nova Scotia announced a strict new 2-week lockdown today after 3 consecutive days of record high COVID-19 cases.
We're in a different situation than we were a year ago. COVID variants require us to act faster, be firmer, and have a broader reach.
Starting tomorrow, schools will be closed. All indoor non-essential services will be shut down. Indoor facilities like gyms and pools will also close. Another 96 new COVID cases were reported in Nova Scotia today. The variants are spreading faster than ever before. The federal government is deploying 60 members of the Canadian Armed Forces to assist at COVID-19 testing centres in Nova Scotia. And in Alberta, people are being warned there is now an unprecedented risk of COVID-19 infection in the province. Today, Alberta's test positivity rate hit a record 11.4%. More than 20,700 people are infected. The hardest hit region per capita is the municipality of Wood Buffalo, home to Fort McMurray and the oil sands. Prime Minister Justin Trudeau says Canada will send $10 million through the Canadian Red Cross to the Indian Red Cross to help that country cope with a record-setting number of COVID-19 infections. The official death toll from COVID in India will soon surpass 200,000. The World Health Organization warns the rush of people gathering at overburdened hospitals may be making the situation worse, allowing the virus to spread even further. Redmond Shannon reports.
Sitting at the hospital gates, it's as close as many Indians with COVID-19 are getting to medical help right now.
And my father is in a very critical condition. I'm getting no help. Numbers are given there, but nobody is responding. Numbers are not reachable. Please help me, please. My father is dying. I can't afford another loss. Yesterday I lost my younger brother.
Trains carry oxygen trucks around the country. It's too late for some, and it's not enough to feed this spiralling demand. Charities ration the precious gas. Others find it on the black market. Dr. Alex Patel is battling COVID in Toronto area hospitals. His uncle Suryakant, who likely has COVID, struggled to find a hospital in Western India.
When you start to hear that hospitals are running out of oxygen, which if you run out of oxygen, you're going to be unable to care for even the most basic COVID patient who comes into hospital, you get very concerned.
Niraj Walia in Surrey, BC, worries his elderly mom risks getting COVID if she ventures out to get the vaccine.
It's very concerning. It's very concerning for me right now, and I'm full with the stress. With the help of international community, I think that's the only way to fix it. Otherwise, it's going to be spread to the whole world.
More international aid arrived in India Tuesday, as a Russian firm says it wants to ship 1 million vials of an antiviral drug.
Good morning, everyone. Bonjour.
Prime Minister Justin Trudeau says Canada will send medical supplies too, plus $10 million to the Indian Red Cross.
This will support everything from ambulance services to buying more PPE locally.
Meanwhile, India's neighbour Pakistan has deployed troops to enforce COVID-19 restrictions, as the trend in cases there points in a similar disturbing direction. Redmond Shannon, Global News, London.
Prime Minister Trudeau faced tough questions again today over a disturbing allegation against Canada's former top soldier, General Jonathan Vance. It's the first time Trudeau has addressed the issue since last week's testimony from a former senior advisor revealed the Prime Minister's chief of staff knew about the allegation and knew it involved personal misconduct. Documents obtained by Global News show senior advisors were told the allegation involved sexual harassment. As Mike Couture reports, they also challenged Trudeau's suggestion today that his office didn't know the details.
Nobody knew that it was a Me Too complaint.
Prime Minister Justin Trudeau again insisted neither he, his defense minister, nor his staff knew the nature of a 2018 allegation against former Chief of the Defense Staff, General Jonathan Vance. However, last week, Elder Marquez, a former senior advisor to the Prime Minister, told a Commons committee he had an inkling.
My presumption was certainly that it could be of a sexual nature, but I don't think I was actually given that information specifically.
An email from a senior bureaucrat at the time to a redacted individual referenced, quote, allegations of sexual harassment flagged by the military ombudsman the previous day. The bureaucrat said at committee the redacted individuals were people in the Prime Minister's office.
Will the Prime Minister be honest with this House and with the women serving bravely in our Canadian Armed Forces that he was aware and he failed them for 3 years?
In response, Trudeau repeated his government took the appropriate actions when they found out about the allegation.
In 2015, when a complaint came forward, we forwarded that to the Privy Council office so that they could do the follow-up necessary. But unfortunately, the Ombudsman was not able to reveal the full extent because he didn't have permission.
But there remain questions about who knew what. Marquez testified last week Trudeau's chief of staff, Katie Telford, was in the loop on the file. Tuesday, Trudeau leapt to her defense.
Katie's leadership on this every step of the way is why we call ourselves a feminist government and why we will continue to look to do more.
The government has promised an independent investigation into the allegations of sexual misconduct in the military. And 3 months after our reporting first brought this to light, senior sources tell Global News an announcement is expected within the next week or two. Mike Lecouteur, Global News, Ottawa.
Caught on camera, coming up, the violent arrest of a woman with dementia and how police joked about it. There's another troubling story about police use of force, this one involving a woman with dementia. The 73-year-old Colorado woman was forcibly arrested last June. Karen Garner wandered out of a Walmart store without paying for about $13 worth of goods. The police body cam footage of her arrest is disturbing.
Come on.
I'm going home.
An officer grabs her arms, pushes her to the ground, and handcuffs her. She appears distressed and repeatedly says she is going home. Her lawyer says her shoulder was dislocated, her arm fractured, and her wrist sprained.
Stand up.
I'm not doing anything.
Right now you're resisting.
Later, in this video from inside the police station, officers congratulate each other on the arrest and laugh about it as they review the video. One officer says, "Here comes the pop," as the woman's shoulder is dislocated. Karen Garner's family is suing the police, alleging excessive force and accusing them of holding her for 6 hours without medical help. They say her dementia has since worsened. One officer has been put on administrative leave, 2 others moved to administrative duties, and a criminal investigation is underway. Tax time, the complications of filing during a pandemic. Friday's deadline for filing your taxes is looming. New options, new rules, and new circumstances mean millions of Canadians are faced with a more complicated tax return this year. If you owe and don't file on time, not only could you be penalized, there may be a delay in receiving other much-needed benefits. As our senior business correspondent Anne Gaviola explains, how and when you file is more important than ever.
2020 was a big adjustment for Amanda Soriano. The pandemic took a toll on her wedding photography side business, and her full-time job became remote.
I was excited for the first 2 weeks, and then as time went by, I was kind of missing the day-to-day interactions with colleagues and essentially leaving the house.
IG Wealth Management says nearly half of filers are making claims related to working remotely this year. For many, that's the new $400 work-from-home tax break.
So as long as you were working from home for 50% of the time since last March, $2 a day up to 200 days, so you can get $400 in total, you can deduct that amount.
COVID-19 relief benefits are a complicating factor impacting about 45% of filings this year. Tax experts say many recipients who owe money haven't budgeted for it. There's some relief if your total taxable income in 2020 was $75,000 or less and you received at least one COVID-19 benefit. You automatically have a grace period on interest for 1 year, but you still have to file by Friday. And missing the deadline could delay a host of other government payments, from the Canada Child Benefit to tax credits and recovery benefits. Accountants are under pressure too, especially at those smaller firms, struggling to keep up with new rules and more paperwork. Chartered professional accountants have asked the federal government to extend the deadline like they did last year, but Ottawa said no.
Clients are having trouble getting information to them. And they're doing a lot more work as well, because they've been helping their clients apply for the wage and rent subsidy and some of the other assistance programs as well. So it's been a very difficult time for them.
How you file is important too. Last year, 90% of filers did so online. And the CRA says processing times for electronic filings are 3 to 5 days compared with 10 to 12 weeks for paper returns. So if you can file online, it is recommended. Anne Gaviola, Global News, Toronto.
Up next, how a love of literature helped 3 women write off the pandemic. During the first 2 waves of this pandemic, few places were more vulnerable than long-term care homes. Thousands of residents got sick and died, and those who survived endured months of lockdown. Well, 3 women who live in long-term care in Calgary found a way to get through by turning to each other and their love of literature. Heather Urix-West has their story.
At long-term care facilities around the world, COVID-19 is having a devastating impact. From the outside, the suffering and loss of life is difficult to watch. For those living inside, it's even harder.
We couldn't see anybody, couldn't go anywhere.
Diana Van Giffen, Heather Graham, and Loretta Scrutchings are residents of Care West Garrison Green in Calgary, a long-term care facility that accommodates seniors and younger adults with disabilities like them. Graham's lived here for 8 years. She has MS, but a sharp mind and an active social circle. That is, until COVID-19 shut everything down.
At certain times there were some of the staff that had come down with COVID, and so we had to be all tested, and then we had to stay in our rooms for 14 days.
Cut off from family and friends and unable to leave, the women took comfort in each other and a shared love of books.
From our book club, we had an idea that, well, we would like to try writing the book.
With the help of a recreational therapist, the trio began writing together in 2018, unaware that the fictional world they were creating would become a place of refuge, an escape from the frightening reality that would surround them soon.
I really think it did help us with the pandemic because, we had something to focus ourselves on.
It's why book 3, written in 2020, is a lot longer than the previous tales.
I started with one line and then we just kept going.
The mysteries, set in a fictional town near Prince Rupert, BC, are now available on Amazon. But the women hope the trilogy tells another story too.
It gave us a chance to show that we're not just wasting away here. Long-term care isn't the end, and you get to live.
Vaccinated now and ready to see what their next chapters will bring. Heather Urix-West, Global News, Calgary.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is one for the books. It's the first supermoon of 2021. It's called a pink supermoon, named after the pink phlox wildflower. A full moon won't be this close to the Earth and this bright for another month, so try to get a look at it if you can. Thanks for watching. Take care of yourselves. Bye-bye.